the response rate there in this very refractory population of lung cancer patients was 18%. And with now 122 patients available for response, we saw a similar response rate. It was 16%. And this was in a very heavily pretreated population. So these patients really, you wouldn't expect them to respond to anything. You know, I think 55% of them had three or more prior lines of therapy for advanced lung cancer. So the response rate was a significant response rate, I think. And the interesting thing was that the folks who did respond, the responses tend to be very long lasting. We don't even know how long because there hasn't been enough follow-up, but we have several patients who are well beyond 1 year. I have a patient who's well beyond 2 years, so it's really amazing results that we're seeing. Not included in that 60% response rate are patients who benefited from the drug but didn't have your classic response per our objective criteria. We call it RECIST criteria. These patients might have initially progressed a little bit, but then went on to respond. And with immunotherapies, we sometimes see this. It might take some time until you realize regression on a radiograph.